Hi, I'm Dr. David Lepp. I specialize in neuro-endocrine immunology here in the Bay Area. I work with a lot of people with autoimmune disorders, complex cases, using tools like functional medicine, functional neurology to get to the source of problems that have not been properly addressed or dealt with.
One of my questions is that I've been asked what the difference between gluten sensitivity and gluten intolerance is.
Right.
Can you answer that?
Well, gluten sensitivity and gluten intolerance, there's different definitions out there. A lot of people have different takes on it. The sensitivity and intolerance are actually kind of similar. The bigger differences is someone producing antibodies that are contributing to an autoimmune process and affecting their immune system versus people that have localized reactions, short-term reactions, and this happens in different parts of the body and different factors like immunoglobulins. For example, someone has a histamine response. They eat something, they get inflamed and swell up, or they need an EpiPen, or they have certain medications they take, which is very different from some of these immunoglobulins like IgA that deals with the membranes of the body, the borders in your gut, in your blood-brain barrier, and how those can break down from exposure to things like gluten and other antigens that would destroy those membranes.
I've heard that to be gluten intolerant is to be gluten free for life. Is that true?
Is gluten intolerant being gluten free for life? Well, I mean, it's a choice. So you can continue to eat it, and that can cause continued discomfort, suffering, and destruction. So I would opt for making the choice. It really depends upon what that person brings to the table. Are there other conditions that are being worsened by the exposure? And a whole lot of other factors that I like to go in depth and kind of figure out for each individual.
In other words, is there a possibility of a cure for gluten intolerance?
Is there a cure for gluten intolerance? If I told you that, no, there are some investigations and some research and experimentation that may, on the horizon, produce some options for people. We're still looking into that. I mean, the human genome has just recently been mapped, so we're just trying to figure out the source of some of the reactions and the expression of a lot of these genetic and antibody producing issues for people. And when we get to the bottom of that, we might have a better idea of, now where can we have an intervention, a therapy, or something that could change our own responses. But unfortunately, we don't have that thing from Star Trek that you can just wave over a person just yet.
I've heard that the end game is celiac disease. Now, if we are unchecked in terms of being totally gluten-free, does that mean we're going to end up with celiac disease?
Well, we won't necessarily end up with celiac disease, but you could wind up with it or a whole host of other immunological or autoimmune conditions. I kind of look at it as the weakest link theory. Everybody has a different genetic profile, and your weakest link may be different than mine, yet if we're both exposed to the same issue that we're sensitive to, that will express first. In some people it might be cardiovascular issues, other people it may be aging and brain issues, people could be gut lining issues, and that may show up in an autoimmune presentation like celiac disease, though it could express in a different way, like thyroid autoimmunity, like Hashimoto's or Graves' disease. There's a whole host of possibilities, and there's no guarantee that a person will develop an autoimmune disease. They could just have the same symptoms and suffer the same degeneration without the same antibody attacking those specific tissues.
So, if I'm having problems, should I get tested? And how do I go about doing it?
Should you get tested if you're having problems? Well, there's a million possibilities as far as what the testing may look like, but it's really the best tools that we have so far, and they're constantly improving. We're learning more all the time. I try to keep up on the latest research, and if something is working better now than it worked before, well, best thing to do, let's use the best test we have. I run a lot of tests for people regularly at one of my two clinics, either here in Campbell, California, or in Berkeley. That would be my BayAreaThyroidCenter.com. There's a whole bunch of neuroendocrine immunologists and functional medicine practitioners around the country. It's a growing field. I belong to a network of them. So this is becoming more and more available. So these are there's a lot of tests we offer, especially when dealing with the immunological findings that we want to know about for a person who's having a presentation of symptoms.
Well, thank you, Dr. Lepp, for
My
your
pleasure.
insights, and looking forward to more lectures from you.
Great, thank you.
Thank you.